Hello and welcome. Today we'll be discussing trauma to the pinna, also known as the auricle or external ear. This often overlooked area is surprisingly vulnerable to injury, and understanding the causes, effects, and treatments of pinna trauma is crucial for ensuring proper healing and minimizing long-term complications. Trauma to the pinna can arise from a variety of causes. Blunt force injuries, such as those sustained during contact sports like wrestling, boxing, or martial arts, are common culprits. Sharp object injuries, like cuts or lacerations from knives or other sharp instruments, can also occur. Animal bites, particularly from dogs, are another significant cause, especially in children. Thermal injuries, including burns from heat or cold, and chemical injuries from exposure to corrosive substances, can also damage the delicate structures of the pinna. Finally, repetitive trauma, such as constant rubbing or pulling on the ear, can lead to long-term issues like cauliflower ear. The pathophysiology of pinna trauma depends largely on the type and severity of the injury. Blunt trauma can cause hematoma formation, where blood collects between the cartilage and the perichondrium, the membrane that provides nutrients to the cartilage. This hematoma can disrupt the blood supply, leading to cartilage necrosis and ultimately, the characteristic deformity known as cauliflower ear. Lacerations and avulsions disrupt the skin and underlying tissues, increasing the risk of infection and scarring. Burns damage the skin and deeper tissues, potentially causing significant disfigurement. Regardless of the initial injury, inflammation and subsequent fibrosis play a crucial role in the healing process and can contribute to long-term complications. The epidemiology of pinna trauma varies depending on the population studied. It's more common in individuals participating in contact sports, particularly wrestling and boxing. Children are at higher risk of animal bites and accidental injuries. The prevalence also depends on socioeconomic factors and geographical location, as access to medical care and occupational hazards can influence the likelihood of pinna trauma. Unfortunately, precise epidemiological data is often limited due to underreporting and the wide range of injury mechanisms. The signs and symptoms of pinna trauma can vary depending on the severity of the injury. Common symptoms include pain, swelling, redness, and bruising. Lacerations and avulsions are visually apparent, with visible cuts or missing portions of the ear. Hematomas present as firm, tender swellings on the ear. In severe cases, there may be significant deformity of the pinna. If the injury is associated with hearing loss, dizziness, or ringing in the ears, it may indicate damage to the middle or inner ear and warrants immediate medical attention. Diagnosis of pinna trauma is typically based on a thorough physical examination. The healthcare provider will carefully assess the extent of the injury, looking for signs of hematoma, lacerations, avulsions, or burns. Palpation is used to identify areas of tenderness and swelling. A hearing test may be performed to evaluate for any associated hearing loss. In some cases, imaging studies such as X-rays or CT scans may be necessary to rule out underlying fractures or other injuries, particularly if there is suspicion of head trauma. Pinna trauma can be classified based on the type of injury. Common classifications included hematomas. These are collections of blood between the cartilage and perichondrium. Lacerations. These are cuts or tears to the skin and underlying tissues. Avulsions. These involve the partial or complete separation of a portion of the ear. Burns. These can be classified by depth and extent, ranging from superficial to full thickness injuries. And finally, infections are also be classified based on severity and the organisms involved. Treatment and management of pinna trauma depend on the specific type and severity of the injury. Small lacerations may be closed with sutures. Hematomas require prompt drainage to prevent cartilage necrosis and cauliflower ear formation. Compression dressings are applied after drainage to prevent re-accumulation of fluid. Avulsions may require surgical repair to restore the ear's appearance. Burns are treated based on their severity, ranging from topical creams to skin grafting. Antibiotics are often prescribed to prevent or treat infection. Pain management is also crucial, and analgesics are typically administered as needed. Prevention of cauliflower ear is a primary goal of treatment. Prevention is key to reducing the incidence of pinna trauma. Protective headgear, such as ear guards or helmets, should be worn during contact sports. Proper supervision of children can help prevent animal bites and accidental injuries. Individuals working in hazardous environments should use appropriate personal protective equipment, including ear protection. Education on the risks of pinna trauma and preventive measures can help reduce the likelihood of these injuries. The prognosis for pinna trauma depends on the severity of the injury and the promptness of treatment. Minor injuries typically heal well with minimal long-term complications. However, more severe injuries, such as those involving cartilage damage or infection, can lead to significant deformity and functional impairment. early and appropriate treatment is crucial for minimizing the risk of complications and optimizing outcomes. Ongoing research focuses on improving techniques for cartilage reconstruction and preventing cauliflower ear formation. New bioengineered materials are being explored for cartilage regeneration, offering promising avenues for future treatment.